Streaming live, this is NewsNation Now.
And a good finally Friday to you. Thanks so much for joining us here on NewsNationNow.com and the NewsNation Facebook page. I am Aaron Nolan. The ever-evolving case of coronavirus continues across the United States. A second vaccine was promoted yesterday, this one by Moderna. We want to talk directly to someone with knowledge of what's going on with now two vaccines here in the United States that will be available for millions of Americans very shortly. We bring in Dr. James Baker from the University of Michigan Medical School. Dr. Baker, we were talking off camera a little bit about how busy it is for you and folks in your profession. This is a hot button time and a time like none other.
This is really a remarkable accomplishment. The fact that 9 months after the pandemic hit, we have two effective vaccines that can literally change the tide. It's really a remarkable achievement.
No doubt it is. As we continue to look at what is happening all across the country, we see spikes in cases from coast to coast, from corner to corner of the United States. The thought process is here, now that we have one in play, a second coming very shortly, this effectively could break the back of this vaccine. Is that correct?
Break the back of the pandemic, yes. I believe that these two vaccines, because they're so effective, can suppress the infection tremendously. If we had a vaccine that was 50% effective and 50% of people still got infected, that's a different equation. But with everyone, essentially 95% of people being protected, this can really stop the cycle of infection.
Let's talk a little bit about the difference in these two vaccines and their approaches to the pandemic, to the coronavirus. What is the difference with the Moderna versus the Pfizer that was approved last week?
So these two vaccines are very similar. They're based on the same technology, which is the RNA that codes for the viral protein spike. And the spike protein is the thing that actually binds the virus to your cells. And what we're trying to do is induce your immune system to make antibodies and cellular responses that actually attack that protein and prevent the virus from infecting your cells. So in fact, we're blocking the viral entry into your body and its ability to infect your cells. It's a very fundamental time point in the infection cycle.
I think, the way you just explained it to me, obviously I'm a layperson, I'm not in the medical field, makes 100% sense. And I think that's the important thing. And then you've got these questions that everybody's going to ask, and I'm sure, Dr. Baker, you have been getting over and over again. Effectiveness, how effective will these vaccines be from person to person? I'm seeing this latest Moderna one at 94%.
Well, the wonderful thing now is that we've done large enough studies that we've looked at people really across the board. We've looked at people from different races, from different sexes, elderly people, young people down to about age 18. And the protection's uniform across all of those. And that's actually pretty remarkable. So that's the other thing that gives us confidence. There's no group that's going to be left behind with this. And there's also no type of toxicity that should prevent anyone from getting these vaccines.
So time frame concern, we know that each of these vaccines, both the Pfizer and Moderna versions, will require two separate shots, two vaccinations. The time frame has begun with the Pfizer for medical personnel. When can other people be expected to get this, as we've got millions of doses that have already been ordered by the United States government?
Yes, I think between both vaccines, there are over 12 million doses available. So that's remarkable. That should do 6 million people. What they're doing now, I think, is protecting people who are first responders and folks in the hospitals that take care of these patients, and that will help tremendously. The other important thing is they're addressing people in nursing facilities and people with people who are elderly and have health issues. And that's important because those are the people that have been really sick and dying from this infection. So if we can cut that off, we'll take pressure off of the hospital systems. They'll be able to recover. And then, probably in March and April, we'll have vaccine for almost everyone that wants it. And by next summer, they'll have studies done in children and we'll be vaccinating young people to go back to school. So I think this is really a progressive turning of the tide in this pandemic.
Dr. James Baker from the University of Michigan Medical School joins us here on News Nation. Dr. Baker, you just mentioned adolescents and younger people. Right now, the focus of the vaccine is for those 17, 18, and older. But your thought process is, you just mentioned it, that the teenagers and the children, maybe by the 21 start to the school year, will also be able to get this vaccine.
Yes, I believe we obviously have to do studies in younger people,
Sure.
and the studies need to be very careful because the risk to them is somewhat different. But the idea that we can immunize young people going back to school and both their teachers and the students don't have to worry about being infected anymore, that will be a real change. And I think at that point, we'll see activities normalizing. We'll see people in school full time. It'll be a very different time period.
Dr. Baker, we are live right now on Facebook across the country. Many different stations have joined us here on News Nation to share this video. And we've got a question for you from one of our viewers. How soon after should I expect to have adverse reactions, if any, to this vaccination?
So this is a very important question. I'm glad they asked this. Most of the adverse reactions are localized to the point of injection and usually occur within 12 to 24 hours. They involve things like swelling or pain at the injection site. Some people, a small proportion, also get tiredness. They feel lethargic, and they get aches and pains, sort of like they have a mild case of the flu. And most of those things happen within the first day or so, and by the next day, people feel fine. The thing that has attracted a lot of attention are these very rare problems where people have had allergic-like reactions. And those are immediate after you get the vaccine. That's why we're suggesting the vaccine be given in areas where people are able to treat allergic reactions. The good news is that the allergic reaction numbers have been very few, and they're certainly not any more than we'd expect from any vaccine that we give. We need to learn why people are having those reactions, but quite honestly, right now, they're no more than what we would have expected. So I think we're good to go with vaccinating the entire population.
Very good question there. Thank you so much, Alonzo, for asking that question. If you have other questions for Dr. Baker, we'll be here for the next few minutes asking questions about the second vaccine that is being pushed through. An approval could come as early as today, maybe this weekend, for another push out for vaccinations next week. Dr. Baker, in my research, I saw that there's a concern of Bell's palsy. Any thought process on that being directly linked to the vaccination?
Well, Bell's palsy is actually an inflammation of the facial nerve. And obviously, you worry about causing inflammation whenever you activate the immune system, even if you have a cold. And in fact, Bell's palsy often follows colds or other types of respiratory infections. In this case, the rates of Bell palsy in both clinical trials, both the Pfizer and Moderna, were very low, and they weren't beyond what would be expected in the age group of the patients who were in the trial. So there's no expectation that this is causing Bell's palsy. I think the FDA appropriately is having us monitor in large scale after people get this vaccine to see whether or not they develop Bell's palsy. But right now, even though there were a few additional cases in the vaccine group, they weren't out of what we would expect in a normal population.
If you're just now joining us here on Facebook or the NewsNationNow.com website, I am Aaron Nolan, joined by Dr. James Baker from the University of Michigan Medical School. Also going to have much more coming up tonight on WGN America at 8 o'clock, 7 o'clock Central for News Nation. 7 to 10, 8 to 11 on the East Coast is our time frame. We're all across the country. Join us there on WGN America. Dr. Baker, before you go, I want to know about the excitement within the medical community. And you mentioned it as we start, but I want to kind of circle back around to that there is, you can see the finish line in this thing, and there's a light at the end of the tunnel. When March begins, so many of us, what is happening? What is going on? And I'm sure it was the same thing for you guys in the medical community. What is the thought process now as we have 2 vaccines that are above 90% effective that people can now start taking to stop this thing?
For the medical community, this has been a war. I mean, literally, you're fighting for people's lives. And it is remarkably difficult to watch people die when you're taking care of them and not really be able to do much about it. The idea that not only can you keep people safe and keep them from getting ill and coming in the hospital, but also protect yourself and your own family from the infection, from taking it home. This is just a dual win on every side. And we were concerned that this pandemic may just go on forever, and it would take a long time for either the infection to burn itself out or for everyone to become immune to it, and that would involve a lot more people dying. This short circuits all of that. So this is a really remarkable day. We've won this war. Not today, we've got 6, maybe 9 more months of fighting, but we can see the end of it, and we know that people will stop dying eventually, and that's a great thing.
That's a great way to put it. Lori has asked us a question on Facebook. When do patients that are high risk get to take this vaccine?
I think the patients that are high risk are in the second group, so that people should certainly contact their physicians and should expect that sometime probably in January or February, they'll be available for the vaccine once they get done with the healthcare workers, the first responders, and the people in assisted living facilities.
Again, this is great news as we start to see millions of vaccines go out. The FDA now looking at a second vaccine. Dr. James Baker from the University of Michigan Medical School, thanks for joining us today.
Thank you so much.
All right, Dr. Baker has been with us throughout this pandemic. He has been on NewsNation several times. We definitely thank him for his time. Very busy very busy man. Dr. Baker, thank you. And don't forget, coming up tonight on WGN America, 8 o'clock, 7 o'clock Central, we've got much more on not only the vaccine, the second vaccine from Moderna. You're seeing some of that video on your screen right now. We're going to have all of that and much more from coast to coast on NewsNation. And if you don't know how to get to WGN America, I encourage you to go to NewsNationNow.com. On the upper right-hand corner, there's a search bar. Simply put in your zip code there, and we will show you exactly how to get it. And we do have exciting news. I know Elise is excited about this, who's producing it. Hulu, if you're on Hulu and you're streaming, you can start to watch NewsNation coming up next month. I'm Aaron Nolan. Have a fantastic weekend, and don't forget, Christmas 1 week away. See you guys.